The newly appointed United Nations Special Rapporteur on the right of everyone to the enjoyment of the highest attainable standard of physical and mental health says that she will centre her work around the theme of vulnerability and the marginalised. Dr Tlaleng Mofokeng was confirmed as an independent expert through a consensus procedure at the Human Rights Council on Friday. In a conversation with the SABC's Sherwin Bryce-Pease, they discussed the importance of her new role, particularly in light of the COVID-19 pandemic.
Dr Tlaleng Mofokeng, thank you so much for speaking with us here on SABC News.
Thank you so much for having me.
So it's kind of a long title, right? We might as well get it out there. The Special Rapporteur on the right of everyone to the enjoyment of the highest attainable standard of physical and mental health. Congratulations on your appointment. I know you were watching that Human Rights Council session on Friday very, very closely. What's your reaction to the news that you are now the Special Rapporteur?
I mean, it's fantastic. I think to be entrusted and given the responsibility of such a big mandate is something that I don't take lightly. I remember going through the interview process and application, and then kind of having to sit in that and really just recognize how big this is, and especially at such a time, of COVID-19 and this global pandemic. So I'm excited, I'm ready, but yes, it's quite a big responsibility.
So a lot of South Africans might not fully understand the role of the Special Rapporteur, right? You have a UN title, but you are not of the UN. You are associated with it, but you're essentially an independent expert that brings your expertise to bear. Just explain that role and your understanding of it.
So I am an independent expert. We called special rapporteurs, and there are many others who have different thematic areas of focus. Mine is specifically around my expertise on health. We have other rapporteurs on racism, violence against women, issues of sanitation, humanitarian issues of law. And so my one is a specific thematic area for the Human Rights Council, focusing on health. And it really is about promoting, protecting, and advancing the human right of everyone to the enjoyment of the highest attainable standard of physical and mental health. And this will take different forms, of course, as I implement the mandate.
Yeah, it's interesting. The Secretary General just this weekend of the UN delivering the Nelson Mandela annual lecture, and he talked about how COVID-19 has been likened to an X-ray revealing fractures in the fragile skeleton of societies we have built. And I want to sort of juxtapose that with this appointment of yours. You really have, it's almost like a runway where an aircraft needs to land and you're the pilot in many ways. Like it's a big role at a big moment in time where the world really has come to understand the fragilities, particularly in terms of access to healthcare in the midst of a pandemic. Just talk to this moment where you have to kind of step into the fray.
And it's very important because when you think of healthcare or the right to health, it encompasses so many other issues and important issues around water and sanitation, malnutrition and food security. It encompasses other determinants of health, like, having healthy communities that are free of violence, having workspaces, that are safe and taking care of the employees. And so COVID is one added factor to all of these other existing inequalities around food security, around housing, around, access to vaccination and malnutrition in children, and the issue, of course, of gender-based violence and, support of survivors post-violence. And so it's not an easy time to really take on the baton, but, I think I'm equal to the task. And it is really about, for me, in any case, for the next, for this term and the next couple of years, is centering my work around the theme of vulnerability as a human right, because, like you rightly say, COVID-19 is exposing so many fractures, so many fault lines, and unless we can respect everyone's humanity and the fact that they have a right to be vulnerable, but they shouldn't be taken advantage of, because they are vulnerable. I think that's one of the things that I will measure my success by, by recentering the marginalized and really focusing on our efforts on those people who desperately need assistance.
And as much as COVID has exposed these vulnerabilities, right, whenever there is a big crisis, Dr. Mofokeng, it is the most vulnerable people. For example, children, women, when we talk about conflicts or pandemics, it's the most vulnerable in our societies that suffer the most. So I wonder how your work as a gender commissioner, that role, your expertise in reproductive and sexual health, how will that inform your approach to this role?
There's a very important lived experience, of being a Black woman in Africa. I think that I will bring into this role. It's a lens of justice, reproductive justice, economic justice, social justice, economic justice, land rights, right? That I will bring to this role, because I think, not wanting to celebrate the many firsts, but it is the first time that the UN has appointed someone that looks like me in this role. And therefore, I think it does mean something. And so for me, it's to lean on all of those experiences that I have as a young girl who grew up in Kwakwa, Bantustan at the time. There's something about growing up in that environment that can be said for other young children across the world, growing up in those very militarized, environments. And so in my own personal life, but also in the life of the many people that I have come across throughout my work as a medical doctor, and of course now as a commissioner at the Commission on Gender Equality. It's those principles. It's that, and for me, I think it's a privilege to be of South African origin and have the kind of constitution that I have that guides me in any case. So for me, human rights and using human rights as a framework is something that is in my blood.
How has being a South African informed this role, right? So let's look at as a rapporteur, you will investigate whatever country situation or, whatever context. You will report back to the Human Rights Council, the General Assembly. What might you say about how South Africa has handled this pandemic, and where are some of the flaws or the holes in that approach that you might have identified?
What COVID has definitely done for South Africa is show the historic and deep structural inequalities that have existed through colonialism, apartheid, even now in democracy. And what it has done is highlighted. So it's the people who are already in the margins, the people who are already vulnerable, so people who are differently abled, who need mobility aids, It's people who dependent on school feeding schemes, who are now left, to be starving, and those are children. It's women who already had to navigate really difficult and violent spaces, just trying to get from work to home and vice versa, that are still, even now, under gender-based violence situations, still suffering the most. So what COVID has done for South Africa is really show us in no uncertain terms that we have a lot of work that needs to be done. If the public health system is going to cater for everyone that needs it, we need a different radical approach in how we really look at strengthening district health. We need to look at procurement. We need to look at, at issues of relying heavily on imports for our medical supplies and consumables, and how much of internal capacity can we really grow and affirm and encourage within the public sector as a whole.
So this is kind of like a final question for you. How are you preparing now? What are you doing now? What are you poring over research? Are you checking out what's going on in different countries? What's going on in your life, right? How's your life changed since Friday?
Yeah. So, part of the biggest role as a special rapporteur on health is to advise the UN on the global trends that are emerging. So that work continues. Of course, it's to take a handover from the outgoing rapporteur, Denias, who's been really, generous with his time. So I've got a few calls, scheduled in. I've got the Pretoria office of the Human Rights Council for induction coming up soon. So yeah, I've got to kind of hit the road running, literally, because we are in the middle of a global pandemic. So there's really no time, for the nice, long-winded, handovers. I kind of have to just roll up my sleeves and go. And the work does very much actually show and feed into the work of the Gender Commission in South Africa. And I think for us as an institution, it's an incredible moment, I think, that can show the type of leadership and expertise, that we can have in South Africa, and how we can influence globally in different spaces of policy and global politics, the issues of gender equality, and really bring unapologetically, those types of efforts for gender equality, but also for the right to health.
That's what I say. I'm just going to quote Ambassador Mhlakato Diseko, who is our permanent representative to Geneva. She said on Friday when this news came through, "I'm very proud of you. You're appointed on merit," of course, beating out a number of other candidates for this position, beating many candidates around the world. We echo that. We're proud of you as South Africans. Congratulations.
Thank you so much, Sherwin. Thank you.
Dr. Tlaleng Mofokeng is the newly appointed Special Rapporteur on the right of everyone to the enjoyment of the highest attainable standard of physical and mental health. Who knew what an important appointment that would be right now?